Okay, picture this. A patient is rushed into the ER. Car accident, unconscious. The doctors, they desperately need their full medical history
Yeah.
right now. Yeah, allergies, Mestheron, past surgeries,
Yeah.
critical stuff, life-saving stuff.
Absolutely vital information in that moment.
But what if their primary doc uses one system, maybe Epic, their specialist uses Cerner, the pharmacy something else entirely?
Yeah, that's the reality we often face.
Exactly. So today, that vital data, it's often trapped in, well, what people call data silos, disconnected.
Fragmented.
And that fragmentation can genuinely put lives at risk. It's a huge, urgent problem.
It really is.
But what if there was a way, a kind of universal translator that's already starting to change how healthcare data flows? Something that, major health systems, big tech companies, even government agencies are seriously betting on.
Okay, I think I know where you're going with this.
It's called FHIR, Fast Healthcare Interoperability Resources.
FHIR, yeah.
And today, we're doing a deep dive into exactly why this tech is so critical and, well, what it really means for all of us, for you.
It's definitely the right time to talk about it. So FHIR, at its heart, it fundamentally changes the game by standardizing how data moves.
Standardizing.
Yeah. It defines how healthcare data communicates. Think of it like a universal digital language between systems that otherwise just wouldn't understand each other.
A common language.
Exactly. And it does this by organizing all this incredibly complex healthcare info into these modular units. They're called resources.
Resources, right.
Think of them like digital Lego blocks, universally recognized shapes. So you have a patient resource, an observation resource that could be lab results, vital signs, or maybe a medication resource.
Okay, so specific chunks of information.
Statistics, structured packets of info, yeah. And the really crucial detail, these resources use modern web formats, things like JSON or XML.
So not some weird, obscure healthcare format.
Not at all. That's the point. It's the same kind of technology that powers the web apps we use every single day. They're accessible via what are called RESTful APIs.
RESTful APIs, like the things my banking app uses.
Yeah.
Or Netflix.
Precisely. It's like a standardized way to ask for and receive data over the web. FHIR just applies that same proven approach to health data.
Okay, that makes sense.
So give me an example. How does that work in practice?
Sure. Let's say there's a mobile app, maybe to help you manage diabetes. That app can make a really simple web request, something like, technically, get patient 123.
Okay.
And it can instantly pull specific patient info from any system that's FHIR enabled.
Any system, really?
Any FHIR enabled system, yes. It means every system, regardless of who made it, can speak the same language. It just cuts through all those proprietary formats, that problem of data being locked away.
That idea of instantaneous retrieval, it sounds almost, I don't know, revolutionary for healthcare. It's often so slow to adapt this stuff.
It is revolutionary in many ways. So, okay, beyond the tech itself, the elegance of it, what's really pushing this forward? Why is it suddenly so urgent, happening right now? It feels like FHIR is everywhere lately.
You're right. It's definitely moved beyond theory. And one of the biggest forces, no question, is regulation.
Ah, the government stepping in.
Yeah, the 21st Century Cures Act. It's this massive piece of legislation, and it specifically requires certified EHR's electronic health records to support patient data access through standardized APIs.
And guess what standard they picked?
Exactly. They picked FHIR. And this isn't just, a friendly suggestion. It's a hard requirement.
So there are consequences for not complying.
Big time. Healthcare organizations that don't comply, they risk losing their EHR certification and maybe even more critically, potentially losing Medicare and Medicaid reimbursements.
Wow. Okay, so the financial stakes are incredibly high. That certainly creates urgency.
It absolutely does. It forces the issue.
But for me, what gets really exciting is the innovation side of it, the stuff it enables. It's like this explosion of new possibilities. You mentioned big tech earlier.
Yeah, they're all in. Apple's health records feature on the iPhone. That's built using FHIR.
Right, I've seen that.
Google Cloud's Healthcare API, FHIR. Microsoft's Azure healthcare stuff, Amazon's Health Lake, all heavily centered around FHIR.
So why is that so significant? What does it unlock?
It enables a whole new app ecosystem for healthcare. Think about it. Developers can now build one FHIR integration.
Just one.
One core integration. And instead of needing like 50 different custom point-to-point connections, that single FHIR integration could potentially connect to hundreds of different health systems.
That's a massive change in scalability.
Huge. It dramatically speeds up development and lowers the cost of innovation.
And that brings us to the opportunity aspect, right, for people actually working in this field.
Absolutely. We are seeing just exploding demand for FHIR skills. It's across the board. Oh, yeah. Health systems, tech companies, consulting firms,
Yeah.
they're all desperate for people who understand how to implement FHIR, build apps using it, manage these integrations.
So if you understand FHIR,
They're becoming a really valuable, almost indispensable asset in this whole evolving healthcare tech landscape. It's a significant career opportunity right now.
okay, so we've established FHIR uses these modular resources. Let's dive a bit deeper into those building blocks. How do they actually work together?
Right. So these resources, they really are the core. There are, I think, around 150 different types now.
150. Wow.
Yeah, it covers a lot. Everything from the basics like patient, practitioner, organization, the who and where,
Ah,
to the clinical stuff like observation for labs and vitals, procedure for things that were done, medication for prescriptions, then administrative things too, like encounter for a visit or appointment.
so it covers the whole spectrum of healthcare data.
Pretty much.
Yeah.
But the real magic isn't just the number of resource types, it's how they reference each other.
How they link together.
Exactly. So an observation resource, say a blood pressure reading, will contain a reference pointing to the specific patient resource it belongs to. A procedure might reference both the patient and the practitioner who performed it.
Ah, okay. So you can follow the links to build a complete picture.
Precisely. Systems can snap these pieces together using those references and construct a really comprehensive clinical view. It makes assembling that data so much easier than before.
But 150 types sounds quite generic. What if a hospital in, say, the US needs something slightly different than one in Germany? Or for a specific project?
That's a great point. The base FHIR resources are designed to be universal, generic, but you often need to tailor them. And that's where profiles and implementation guides come in.
Profiles, like customizing the resource.
Exactly. Think of profiles as localization kits or constraint sets for FHIR. They let you customize a generic resource by, say, making certain fields mandatory for your use case or adding specific codes from a required terminology. So, for instance, here in the United States, the U.S. Core Implementation Guide is absolutely critical.
US Core. I've heard that term.
Yeah, it defines exactly which FHIR elements and data points are needed for interoperability in the U.S. It's based on something called the U.S. CDI, the U.S. Core Data for Interoperability, and CMS actually mandates its use for regulatory compliance.
So that guide ensures everyone in the US using FHIR is doing it in a compatible way.
That's the goal. It promotes consistency so systems can actually talk to each other meaningfully.
But what if you need something really specific? Something not even in US Core, like tracking a rare genetic marker for a clinical trial.
Right. Sometimes even a profile isn't enough for niche data. FHIR planned for this with something called extensions.
Extensions, so adding extra bits.
Pretty much. They offer flexibility. You can add custom data fields directly onto a standard resource using an extension.
But doesn't that break the standard, make it incompatible again?
That's the clever part. Systems that don't understand your specific extension just ignore it. They can still process the rest of the standard resource data just fine, so you maintain that base compatibility while still adding what you need.
Okay. That sounds quite flexible.
It is. And then there's another really transformative piece, SMART on FHIR.
Smart on FHIR. Okay, what's that?
It's a framework, basically a set of open standards for securely integrating third-party apps directly with EHR systems.
Integrating apps into the EHR, like embedding them.
Exactly. It uses standard security protocols, specifically OAuth 2.0.
Like when you log into one website using your Google account.
Very similar concept, yes. It gives the app secure, limited access, like a valet key for specific data it's authorized to see, rather than handing over your main EHR password.
Okay, secure access.
And then it uses the FHIR APIs we've been talking about for the actual data access. So developers can build these powerful apps, maybe a specialized calculator, a risk score tool, clinical decisions support, and embed them right into the workflow of major EHRs, like Epic or Cerner. The clinician sees the app within their normal screen using real-time patient data pulled via FHIR.
So you get specialized tools working directly with the patient's latest info.
Right inside the workflow. Major EHR vendors now even have app galleries like an app store, but filled with these smart on FHIR apps. It's creating that ecosystem we talked about.
That app ecosystem idea sounds incredibly powerful, really bringing healthcare into the, modern digital age, finally.
It's a huge step.
So for anyone listening who wants to be part of this, maybe a developer or an IT person, what are the actual, hands-on skills needed? What are the real-world applications people are building?
Well, one of the most fundamental, and it sounds simple, but it's actually quite complex, is resource mapping.
Mapping, like translating.
Exactly. Hospitals and clinics have decades of data in older legacy systems, their own weird formats. Someone needs to figure out how to translate that data into standard FHIR resources.
So taking an old field called Pete name and mapping it correctly to the standard patient.name structure in FHIR.
Precisely. It sounds tedious, maybe, but it's absolutely crucial. You need to understand the old system's data in the FHIR standard and the clinical meaning of the data. It's a big part of any implementation project.
I can imagine that's where a lot of the initial work and maybe some headaches happen.
Definitely. Then naturally, there's API development and testing. FHIR is all about these RESTful APIs.
Right.
So you need people who can build these APIs, test them thoroughly, make sure they work correctly and securely, using tools like Postman, working with FHIR test servers or sandboxes, writing automated tests. It's core software development skill applied to FHIR.
Making sure that get patient call actually works reliably.
And securely.
Sure.
Which brings us to the next critical piece, security and privacy implementation.
Hugely important in healthcare. Non-negotiable, really.
Absolutely paramount. FHIR itself includes robust security features. It builds on standards like OAuth 2.0, recommends encryption, defines audit trails. But the key is they must be implemented correctly.
Just having the feature isn't enough.
Right. A misconfigured FHIR server is a massive data breach waiting to happen. Huge IPAY fines, loss of trust. So you need people who understand how to set up authentication properly, handle encryption, and implement detailed audit logging, often using FHIR's own audit event resource. Security has to be baked in from day one.
Cannot be an afterthought.
Never. And finally, one of the really exciting application areas is clinical decision support integration, CDS.
Using the data to help doctors make better decisions in real time.
Exactly. FHIR has a whole module focused on clinical reasoning. You can use it to build intelligent tools that provide real-time guidance within the EHR workflow.
Like what kinds of tools?
Oh, things like drug interaction alerts that pop up automatically. Tools that check care against established clinical guidelines. Risk stratification tools, maybe identifying patients at high risk for readmission based on their FHIR observation or procedure history.
So using the patient's own data, pulled
Yeah.
via FHIR, to trigger helpful advice for the doctor.
Precisely. It's about making care safer and more effective. And again, the industry really needs specialists who get both clinical side and the FHIR tech side to build these powerful tools effectively.
Okay, we've painted a pretty exciting picture of the potential here. But let's be realistic, too. It can't all be smooth sailing. What are some of the common, maybe, pitfalls or mistakes organizations make when they try to implement FHIR?
That's important to cover. Yeah, definitely some hurdles. Probably the biggest misconception is thinking that just, doing FHIR automatically solves every single interoperability problem.
Like it's a magic wand.
Kind of. It provides the standard, the foundation, which is huge. But true interoperability, that still requires consistent implementation, careful profiling, and really importantly, semantic alignment, making sure everyone agrees on what the data means.
So you could have two hospitals both using FHIR, but they still can't share data properly.
Absolutely, I've seen it. Maybe they created totally custom, incompatible profiles. Or one uses SNOMED codes for diagnoses and the other uses ICD-10 in a non-standard way within FHIR. They're both doing FHIR, but they can't understand each other's data.
So the solution there is?
Stick to established implementation guides like US Core we mentioned. Use standard terminologies like SNOMED, Alloyancy, RX norm consistently. Don't reinvent the wheel unnecessarily.
Right. Follow the common guidelines. What else?
Another major pitfall is neglecting security until it's too late. We touched on this, but it bears repeating.
Build it in from the start.
Build it in from day one. You can't just focus on getting the data flowing and then try to bolt security on afterwards. It doesn't work, especially not in healthcare. Implement those FHIR security guidelines rigorously from the beginning.
Makes sense. Anything else to watch out for?
Yeah, one more thing is maybe overcomplicating profiles. It can be tempting when you first get into profiles and extensions to make them super specific. Add Tons of custom extensions to perfectly match your internal workflow.
Trying to make it fit exactly how you do things today.
Right. But remember, the main goal of FHIR is interoperability, sharing data between systems. Overly complex, highly customized profiles can actually make that harder.
Because other systems won't understand all your custom bits.
Exactly. So the general advice is usually start simple. Use the base standard and establish guides like US Core as much as possible. Add constraints or extensions only when truly necessary, and always test for broader compatibility. Simpler is often more interoperable.
That's really practical advice. Okay, so maybe a final thought for our listeners to take away from this deep dive.
Well, I think the main thing is
Go ahead.
oh, sorry. I'd say the main takeaway is that FHIR isn't just another standard that might, fade away.
Right. It feels different this time.
It is different. It's mandated by regulation.
Yeah.
It's being adopted by literally every major player in the industry, EHR vendors, tech giants, government agencies, hospitals. It is becoming the foundational layer for the next generation of healthcare IT and applications.
So whether you're a developer thinking about specializing, or maybe you're an IT admin dealing with these new interoperability rules, or even if you're a doctor or nurse just wondering why your systems are finally starting to talk to each other,
Uh-huh.
understanding FHIR, at least at a conceptual level, is becoming pretty essential.
Absolutely essential.
It really feels like the healthcare industry is finally getting the kind of modern data infrastructure it needs, the kind that can support truly better, more connected patient care.
It's been a long time coming.
And FHIR, it seems, is the key technology making that possible right now. Something to really think about.